Surgeons for Little Lives is a charity based in Johannesburg. It was started in 2015.
I have been working for the charity for almost 6 years now. In actual fact, I was the first employee. So right now we have grown. There's about 8 of us working for the charity, which shows just how much we have grown and which shows how much the need has become.
It's helped in the management of children, and it's helped in the management of parents as well, because when we treat children, we're actually treating whole families, and what we do has quite a far-reaching impact.
You actually see these patients are growing, thriving, and they do better post-op and they go home sooner.
The specific issues that are faced in the South African healthcare system in general are combated in small ways by the charity.
People that are trained in the public healthcare system are able to go to private where there's a less strain on resources and deliver really phenomenal care. And we didn't think that it was fair that we were able to do that in private but not in public, because all of us actually train in the public sector. I mean, excellent private care exists because of excellence in the public sector.
So when we started, we were focusing on big infrastructure buildings and projects.
I'm sure most people are familiar with our new surgical outpatients facility, and that replaced essentially what was a 2 or 3 room prefab hut.
I remember in the beginning it was in the shack.
The door had a little hole where the rats would come in at night because it was so old.
One of the flagship projects of the charity was to completely replace this with this new modern facility that we have.
There's more space, there's more doctors' rooms, and there's more facilities for kids to play.
We were able to really counsel patients in a much more dignified manner than we were before.
So when we first came here, my baby was quite sick. We had been transferred from another hospital, Telemokhorane, and we were brought here to meet with one of the specialists. The surgery was successful, thank goodness. She had issues with her liver. The doctor explained everything in quite a lot of detail so I could understand what was happening. The whole team is so friendly and so professional from start to finish. Everyone is just very helpful. Everyone's got a smile on their face, very friendly.
When they come here, they can't believe it. They think it's a private facility. I remember one mother saying, "No, sister, I cannot sleep here. I cannot be admitted up there. I don't have money to pay." Then we had to tell her that no, it's still part of Para.
We've got a place where mothers can lodge.
The parental sleepover facility was such an amazing blessing because I can stay up until she falls asleep and then just go a few feet away and, also get some rest and be able to be available to her right after she wakes up is an amazing thing.
This new admissions ward is also one of the big, massive infrastructure projects that the charity embarked on in its early stages.
Surgeons for Little Lives has made it possible for me to do my job as an occupational therapist. I need to basically do activities with our burn-injured children to make sure that their burns don't detract from their mobility and their psychological health and their development.
The charity also does very basic things which are not provided for by the state but immeasurably contribute to the care of the patients in our facility and those that are supported by the charity.
And we also offer admissions and discharge packs for the patients.
They've also organized a wonderful art therapist who the children absolutely love.
We've been running a program here for about 9, nearly 10 years. You can actually visibly see how the children relax once they get something creative to do.
Many of our patients are here for a long period of time, so it also creates an environment where they can still learn and grow despite being in a hospital environment.
Not only are we focusing on clinical service delivery within the hospital,
but currently we have grown, so we do outreach programs outside of the hospital.
So we've been able to reach a lot of people for primary prevention purposes through radio shows that have hosted us.
We've had very, very positive feedback from our community. It gives you the feeling that you're not alone. It gives you a feeling that there are really doctors in the world who really care.
One of the other big community outreach programs that we've engaged in is a pediatric burns education campaign,
where we go into the community educating families on how to protect their children to avoid burns, whether it be from hot water, flame burns, because of the community environment that they are from.
I educate the mothers how to prevent burns at home. We give them the pamphlets, and then there's a TV where we show the mothers how to treat burns in the hospital.
So another very interesting project that we would like to embark on, that we are soon to pilot, is a limited telemedicine program, and the reason for that is in response to the needs of our patients. It has simply become unaffordable for patients to be able to come to the hospital, take time off work, and even just afford the transport. One of the early needs identified by the charity was the need to train more pediatric surgeons, not only in South Africa, but outside of the borders of South Africa.
We are supported with research, with attending conferences, with grants, for the equipment, for our personal equipment to use to operate.
In addition to the training component is the formalization of a suspected child abuse and neglect program.
So we work as a team. Everybody is got their own roles, but everybody's got a say in what we do.
So Surgeons for Little Lives is not only about the medical professionals or the doctors that deliver the care.
And everybody's really motivated for the same goal of treating children and making their lives better.
That definitely creates like a camaraderie between the multidisciplinary team that we have with the nurses, the doctors, all the allied staff, the volunteers.
I feel like this is one of the units in the hospital where we have the most teamwork, and we are collaborating with each other the best that we possibly can in order to make sure that our patients at the end of the day walk home with as little effect of the burns as possible.
The surgeons cannot work without us, we cannot work without them, so we're working well with each other.
And it's just always so rewarding, and it would bring us back, I think, that you're able to send home a happy, bouncing child running around and happy parents, and that's our goal.
Going into the future, we have several plans, large scale and small scale.
We are really working towards expanding the organization even further.
We will be performing a full upgrade of the pediatric burns unit in Baragwanath Hospital. This is one of only 2 pediatric burns units within the entire country. We have also instituted a system of electronic medical records.
Through the use of the database, which is built through the infrastructure from Surgeons for Little Lives, I've been able to tap into that, and that's helped us to really progress medicine and improve the outcomes.
We're also looking forward to establishing a new dedicated pediatric emergency department at Chris Hani Baragwanath Hospital.
I'd like to say thank you to all the people that come out to come and offer their help to us in terms of volunteering, in terms of donating. It really goes a long way, and we really appreciate it.
They definitely changed my perspective on patient care and how interacting with a patient as well as a family member changes a patient's outcome. That it's not just about the medicine, it's about the patient as well.
I'd like to say to Surgeons for Little Lives that they've been a life changer. They have really made a huge impact on me and on my child's life, and I can't say thank you enough for everything that they have done.
It's changed the way that we practice pediatric surgery, and that we're able to be more holistic, and that we're able to have empathy for the circumstances that they come from.
And my only hope is that it maintains and it grows bigger and better and just reaches out further to help more children and more nurses and doctors, and just keep everybody motivated.
And we see each and every time that more sponsors are coming in, and then there's a lot of improvement.
Surgeons for Little Lives, big ups for it.
I think that the staff and the allies and the nurses and the doctors here at Baragwanath Hospital care a lot about our patients, and we give a lot of our lives and our time and our efforts and our thoughts to these children, and we want to see them through to recovery. But we can only do that with help and support from organizations like Surgeons for Little Lives. And we hope and pray that the support will continue and even grow so that we can do even better for children in the future.
We are the line in the sand. We should provide excellent care to our patients in the public sector because we can, and it is our absolute privilege to be able to do so.